Dr. Diskin, if you could wave your nephrologist's magic wand and fund an additional member of the in-center interdisciplinary team, what would that position be, and what responsibilities would that person have?
What I would do is, when you look at the structure of a dialysis center, there isn't someone in the center who can help the patients focus on exercise. That's where I would start with, would be some type of exercise professional who can meet with the patients while they're on dialysis and design individualized exercise regimens for them that they can complete during their dialysis sessions, and also encourage them to work more at home and to do aerobic exercises and follow up with them, sort of in the way that a personal trainer might for people who go to the gym.
That's Dr. Dyer Diskin, MD, a nephrology fellow at the Stanford University School of Medicine, and this is NephTalk, a podcast series created with nephrologists in mind from Satellite Healthcare, a not-for-profit dialysis provider and clinical researcher with a special focus on home as the industry's home dialysis leader. I'm Christopher Springman. Satellite Healthcare has funded your research into patients with end-stage renal disease, ESRD, receiving in-center hemodialysis. Patients who often suffer from high rates of frailty, physical inactivity, and mortality. What is frailty? It's a word often used very casually by people, but what is the medical definition that is so significant to your work?
Frailty is something that we talk about very casually, but it actually does have a very specific medical definition. And most of that medical definition is based off of how strong a patient's grip is and what their walking speed is, which is sort of a reflection of gait, balance, and lower leg strength. And a lot more older people are getting access to dialysis at a later stage in their life. So it is something that is very important to focus on in the dialysis population.
For a statistical comparison, how would you compare the rate of frailty among people who do not have end-stage renal disease with those who do?
In the community-dwelling population of people more than 65 years old, the rate of frailty is around 7%. However, when you look at the end-stage renal population, the patients who are on dialysis, it can be as high as about 75%. And that's for people who are over 65 on dialysis. There's also a very disproportionate rate of frailty amongst younger dialysis patients, those who are less than 65, and that discrepancy between them and the general population is even larger.
Frailty often leads to multiple adverse outcomes, including procedural complications, falls, institutionalization, disability, and death. Those are very serious and very unpleasant outcomes.
Absolutely. In dialysis patients, one of the classic examples is falling and fear of falling. So if a patient has had a fall, they're much more likely to have a fracture if they're a dialysis patient because of the way calcium and phosphorus are balanced in a patient without kidney function. Their bones are much weaker. Their mobility gets much worse. Their fear of falling limits them from doing further exercises and being more mobile, and they just will get caught in a very downward spiral that oftentimes will end in death.
You have just completed your study, is that correct?
Yes.
How would you describe the results? Because this is a work in progress. And I'm wondering, too, if there were any pleasant surprises, unexpected positive outcomes that startled you a little bit.
When you go back in history, there have been various attempts to get dialysis patients to exercise that have mostly focused on passive reinforcement and using foot pedals. And there were some difficulties with that in the longevity of maintaining these outcomes in that patient population because of mechanical issues. And so our goal was to see if we can bring exercise professionals to patients while they're on dialysis and teach them some simple exercises using those resistance bands that they are much more open to working with as opposed to dumbbells.
You've suggested that patients using weights really didn't work out well in the in-center dialysis environment. They were a little intimidating.
Absolutely. And studies have shown that when you look at these elastic resistance bands, that patients have a lot less preconceived notion of what they can or cannot do as opposed to a dumbbell. That was one of the reasons that we went with that approach, because it's been shown to be a little bit better for the patient population that we were targeting.
What do patients have to gain from the exercise program, especially those patients who are seriously considering a transplant and who have hope and, frankly, the aspiration of achieving that?
Unfortunately, we have more and more end-stage kidney disease in the United States. There have become issues with wait times for kidney transplants. And oftentimes in the Bay Area and even throughout the Southeast as well, sometimes the wait time for a kidney can be between 6 and 8 years. And what happens is someone will get on the transplant list and they will seem that they're a good candidate, they're functional, they're independent, but then 6 years later, their physical function may have declined. And we're hoping that programs like this will keep those patients physically active, because a lot of kidney transplant centers are looking at transplant readiness assessment clinics where they do a lot of these physical function tests that we do, where we measure their walking speed, their lower extremity strength, mini mental status exams to make sure that they are still going to have a good outcome, because patients who are very medically frail do not have improved outcomes with kidney transplant like the traditional patient population would. So we're keeping them well so that they can get that transplant when the time comes.
Patients who have used these exercise bands in center have requested additional bands for their family members so they can exercise at home with a partner.
Yes. One of the things that I was very surprised at was that the patients are doing these exercises at home, and that we are getting a lot of positive feedback from the patients and their caregivers. Sometimes they can be a little hesitant, particularly if they haven't been physically active in a long time. And they also wanted to participate in these exercises and were the biggest champions of it. We provided all the patients with extra bands at home. And that's the other nice thing about these rubber bands, is they come on very large rolls, and it's very easy to just spool off a little bit more, cut it, give them the right length, and teach them how to use it, which the people that we employed are experts. They're the professionals in this world. So the patients are in the center. They're sitting down in a dialysis chair. They have the needles in their fistula. The blood is going through the machine and being pumped and being actively put through this dialyzer. And they're oftentimes in this process for 3 to 4 hours. So the goal is to focus on using meaningful time during dialysis. And this is one way to do that, by focusing on health and mobility.
Meaningful time is a term that often comes up with a satellite healthcare program to introduce humor, laughing into the dialysis experience, along with bingo night and other socially engaging programs.
Yes, absolutely. My mentor in this area, Paul Bennett, did the Laugh Out Loud study with satellite healthcare that looked at doing laughter therapy during dialysis. Many patients were very receptive. They've also looked at painting on dialysis, and I know of one particular dialysis center where one of the dietitians organizes a bingo night, and all the patients get involved in that and really enjoy it.
Exercise programs have a long tradition. The implementation issue seems to be a large part of the challenge. Do you envision a day when a typical nephrologist prescription for dialysis will include an exercise program or regimen?
Absolutely. If we do have an exercise professional to make sure that we're seeing every single one of the patients, and we could play a role in identifying the patients who need that intervention the most, and identifying when the patient may need a little bit of extra help in helping us design these regimens for the patient, because every patient is also different and has different goals, and they have different expectations, and they have different abilities. So being able to individualize that, I think, is also very key, as opposed to giving blanket prescriptions to a large group of dialysis patients.
I'm very glad you brought that up, because my understanding from reading the literature is that there is a higher rate of participation and therefore success among patients who have a partner and who are supervised.
And I think if we all reach deep down, we can probably look at ourselves even in examples of that. A lot of people feel as though they're more likely to exercise if they have it scheduled, if they have a personal trainer who's going to meet them there and work with it. And unfortunately, dialysis patients do suffer from a high rate of medical comorbidity, and they have oftentimes a lot of reasons why they might not feel 100% and might not want to exercise. When they've done studies that have focused on what do the patients want out of an exercise program, they feel as though they don't know enough to structure an exercise program for themselves. They don't trust their own knowledge about what type of exercises are safe.
This goes back to my original question about changing staffing with the inclusion of an exercise professional in center who's solely responsible for the exercise program, will get to know patients on an individual basis, can track their progress, and be not only encouraging, but also a bit of a cheerleader.
I think a lot of these patients need that cheerleader effect because dialysis patients do suffer from high rates of depression as well. And having an extra person to talk to and to engage with helps stimulate their mind, and these people can also help stimulate their body as well.
That is one of the values of research. When you come up with hard numbers, they are very appealing to insurance companies and other payers who like to see results and outcomes clarified on paper, hard numbers.
We were trying to take that first step in saying, okay, is it feasible to do something like this in a United States dialysis population? We based it off of Paul Bennett's study that he did in a similar population in Australia. It's all controlled by the government, and I was very lucky that I worked for a dialysis company like Satellite Healthcare that is so focused on patient quality and trying to improve their lives in meaningful ways and isn't necessarily completely focused on things like liability and cost. They want to focus on the patients in their lives, and I'm very grateful to have worked for a company like that.
That's a wonderful opportunity to discuss your backstory and that of your father, who is a practicing nephrologist, who is almost 70, and he's still working very hard.
Yes.
He originally worked with Dr. Norm Copeland at Stanford University. Dr. Copeland was the founder of Satellite Healthcare, and I believe Dr. Copeland told your father to get out of the ivory tower and get out there among patients and find out what they need and want. Is that an accurate quote?
Absolutely. My father graduated there in the early 80s, and I think Norm Copeland was definitely one of his mentors. He said that very thing, that they weren't really sure what the future of dialysis was going to look like, but Norm really believed in the dream of setting up these dialysis centers that were satellites of Stanford, that in this particular pocket of Alabama, there were only 2 places in the entire state you could get dialysis in the early 80s. And so he moved here and established a big grouping of dialysis centers in the Auburn-Opelika area and still practices to this day.
People would drive 4 hours across Alabama to the nearest dialysis clinic.
Yeah, 2 hours each way, 3 times a week sometimes, or more, depending on how far they had to go. And that was a big impingement on their quality of life just to stay alive. And I certainly think he has had a major impact on maybe thousands of lives in this area. And certainly very proud of him for that as well. And I hope to continue that legacy.
Medicine, patients, and the profession need your father to continue working for at least another 10 years. Will that be a hard sell?
Well, we'll see about that. I'm sure that he, if it were up to him, he would probably never retire.
I know the R word is difficult, but he's obviously made quite a contribution. Also encouraging you to go into practice too.
I grew up in a dialysis unit, going there with my father after hours if he had to finish some work. You know, renal physiology kind of always came a little bit more natural to me, maybe because I was exposed to it so early. And I decided that I wanted to spend my life taking care of kidney disease, being a nephrologist.
What do patients tell you, one-to-one, that they really want out of all this? What are their ultimate expectations, that perhaps dialysis will be an end in itself, or do they have other dreams, hopes, and aspirations?
Well, most of them do have dreams of some type of kidney recovery or trying to limit dialysis. Most of them are hoping for transplant. Some of them who are a little bit older or maybe a little bit too frail, not necessarily because they don't deserve a kidney, but because it's not likely to improve their lifespan, and the surgery itself may be too much for them in the short term. So most patients are looking forward to a transplant and a life off of dialysis. I think that what we can do is make their dialysis time more meaningful in the best way that we can.
Ultimately, their candidacy for a transplant will, in great part or significantly, be determined by their physical condition. And that dovetails very nicely into the exercise program that you have been researching.
Absolutely. You have to have a certain degree of independence and physical function in order to be able to tolerate a kidney transplant and all of the stuff that comes after it. There's a certain amount of things that the patient has to be able to do to undergo transplant, and the physical aspects of it, if nothing else, slow the deterioration of physical function that happens on dialysis.
What is your next step here? You've completed the study.
The next step from a research perspective would be designing a larger trial that follows patients for a much longer period of time, maybe 1 to 2 years, and looks at patient-oriented outcomes. So instead of walking speed, hand grip strength, it's going to be falls, hospitalizations, mortality. Also looking at ways that we can get these exercise professionals into the dialysis centers. One of the things that we can look at doing is partnering with institutions, like we worked with San Jose State University. They're an academic teaching place for kinesiology, and for their students, they need to give them clinical exposure as well. I got to learn a whole lot about kinesiology and sports medicine and their training through meeting these exercise professionals, and I'm very thankful for that. If we could set up a system where dialysis units are some of the clinical rotation sites for these training exercise professionals, that we could both give them an exposure to patients who seem very medically frail, but if you challenge them and you work with them, they may surprise you. The dialysis patients would get exercise instruction under the guise of the students and their teachers who are experts in this area.
I'm sure the patients would enjoy the company and the conversation and the additional motivation.
Absolutely. That was one of the things that we really wanted to do, was create an exercise program that doesn't disrupt the workflow of the dialysis center, isn't invasive to other patients who don't want to be bothered with it. Set up something that can be done in the long term. We want a program like this to have longevity. By putting somebody in the dialysis center to focus on just that one thing is a key to making these programs stick.
Dr. Diskin, thank you so much for joining us today on NephTalk.
Well, thank you, Christopher. It's been a pleasure to be here.